Hey everyone, Dr. Charlie Johnson, physical therapist, and I am moved to create this video because I've seen this case multiple times in the last few days. This video is for you if you've been diagnosed with tennis elbow, okay, the fancy term is lateral epicondylitis, okay, but not really, okay? So if you've been diagnosed with tennis elbow, this video is for you. So big thing, first things first, I just want to throw this out there. So for quite some time now, what we've seen is that we've actually gone in, right? So if you have lateral epicondylitis, right, itis infers that it's some type of inflammatory process. So maybe you've been to physical therapy, you've tried icing it, you've tried taking some type of ibuprofen or other anti-inflammatory, and you're just not getting the relief that you want, okay? Maybe you've had elbow pain, lateral epicondylitis, or tennis elbow now for a year or 2 years or even more, okay? Muscles heal, okay? So if you strain a muscle, most muscles will heal within 3 months or so, okay? Elbow pain or any pain that lasts for an extended period of time greater than that normal healing time frame, okay, is likely not due to any type of local muscle problem, okay? So even though your elbow hurts right here, okay, or right on the outside, most of the time this tennis elbow is not really tennis elbow and it's not an itis, okay? So what we've actually seen, okay, in the medical world is that we've gone in and we've looked at people with elbow pain. We've gone in and we've taken little samples of their tissue, and we've actually seen that there are no inflammatory cells or processes going on, okay? What does that mean? That all the ice and all the anti-inflammatories won't do any good, okay? Also what it means is that basically we aren't always sure what's going on, okay? So that's kind of the good and the bad, right? So you kind of have an idea that it isn't an itis maybe, but what is it then? So a lot of times what we see actually is that people with elbow pain on the outside, tennis elbow, okay, as well as people, this is kind of an off topic, but like with carpal tunnel, okay, often have pain or problems in the neck or in the shoulder, all right? And if you're sitting here watching this, you may be feeling some discomfort up in the neck, all right? And what we see is that a lot of times this elbow pain is actually due to some type of irritation, either stemming from the neck or one of the nerves that runs down the arm, okay? Again, if you're watching this and you have elbow pain and you happen to also notice some kind of discomfort going into the area of your thumb, and that your tenderness kind of goes right down through the middle of the forearm and it's most tender kind of in this area, then this is then you likely don't have a tennis elbow. Rather, it's this nerve or other issue, okay? So here's how you're going to test it. If you have tennis elbow, do this test right now. So if it's on your right side, do this test on your left side first so you can compare, but I'll just show it on the, let's just say in this case, the right side, okay? So what you're going to do is you're just going to take that arm that bothers you, right? And you're just going to extend it in this position, okay? You may feel a little bit of a pull already in that position, kind of on the outside of the arm, maybe into the hand. Yeah, so what you're going to do is sit it there, okay? And what I want you to do is tilt your opposite ear towards your opposite shoulder, okay? You're just going to do this, all right? If, when you tilt your head the opposite way, okay, away from the side that's bothering you, and you notice you get significant kind of discomfort or some tightness that goes down the arm, all right, and it's different than the other side, all right, and it's pretty clearly discomforting. Maybe you notice some numbness, tingling while doing it or even afterwards. You don't have tennis elbow, okay? So that's the good news. What you need to do is you need to find a good physical therapist in your area who understands nerves, okay, and what's going on with them and how to best treat them, okay? They can be tricky, but once you understand what's going on, then you have a better chance of feeling better, okay? So the issue is not tennis elbow. It is in fact one of the nerves that crosses right near the elbow and causes discomfort. Sometimes this can be caused by problems up at the neck or in the shoulder that continue to make this nerve sensitive, okay? So try those things out. Final tip, corticosteroid injections to the elbow are not good, okay? So what we've seen is that steroid injections too, if you've been thinking of those, to the elbow show good short-term effects for pain relief, but long-term they are actually detrimental to just waiting and doing nothing, okay? So they're detrimental to your recovery. Shy away from those, okay? So if you have any specific questions, email me at charliejohnsondpt@gmail.com. I'll do the best I can to help you out, all right? Hopefully you find this helpful. Take care.